We'll be seeing what an arthroscopic repair is done in case of a recurrent dislocation of the shoulder. Recurrent dislocation of the shoulder is more common in younger individuals, especially below the age of 40 years. What happens in a recurrent dislocation of shoulder is that the ball pops out of the socket. Now we need to understand that there are a lot of structures around the shoulder which help in stabilizing it, especially the muscles, the soft tissue, the ligaments around the shoulder, which we call the labrum, and the capsule. Now, in younger individuals, generally the shoulder dislocation is due to a tear in the ligaments or the labrum. Whereas in people above the age of 50 years, the shoulder dislocations are generally due to muscle tears or massive rotator cuff tears. Now, this procedure is mainly aimed at younger individuals in whom we need to repair the soft tissues and the ligaments so as to make the shoulder stable again and to prevent it from coming out. So as can be seen in this picture, there is a tear of the anterior capsulolabral structure or the ligaments of the shoulder, and which are repaired with the help of devices which are known as suture anchors. So these are small devices which have sutures in them which are passed through the soft tissue which help in repairing the ligaments and the tissues around the shoulder to the bone, which helps in stabilizing it. The bone here mainly is the socket or what we call as the glenoid. So essentially the capsule and the labrum is repaired to the glenoid. Nowadays these procedures can be done arthroscopically. Arthroscopically essentially means to look inside the joint. This is done through small cuts about the size of your fingernails around your shoulder joint, through which we are able to pass instruments inside the joint, the cameras to view the pathology inside the joint and to treat it. Now we will be seeing a brief video of an arthroscopic Bankart repair. So this is the bird's eye view inside the shoulder. Viewing through the camera, you can see that the ligaments and tissues from the socket are detached. This is what we essentially call as a Bankart lesion. The aim of the procedure would be to take stitches through this tissue and then anchor it to the bone which we see on the left, or the socket or the glenoid. So since this is done arthroscopically, the cuts around the shoulder are very small, the post-operative recovery is pretty fast, and you are able to go home the same day or the next day of the procedure. There is a standardized rehabilitation protocol after following which you should be able to get back to your level of activity. Now you can see that we have passed anchors through the bone and these stitches are being shuttled through the soft tissue, and with the help of various knot tying techniques we'll be able to secure this tissue back to the bone. So after suture passage, you can see that with the help of arthroscopic knot tying techniques, we are attaching the tissue back to the bone. These knots, once secured, will hold the tissue there, and subsequent procedures which we have done will ensure the healing of the ligaments and the soft tissue in front of the shoulder back to the socket, which will prevent a redislocation. So once the sutures are tied and the knots are put, the remainder of the sutures are cut. Sequentially like this, we put about 3 to 4 anchors in a standard Bankart repair. That's the recommended amount, that we need at least 4 fixation points. Now you can see that the soft tissue which was earlier detached from the whole of the socket or the glenoid has come back and is reattached there. So this recreates the soft tissue tension, or what we call as a labral bumper, which helps redislocation in the future. Now these anchors or the soft various materials, like they could be plastic, they could be made up of biocomposite or a biodegradable substance or metal. Generally we prefer biocomposite or biodegradable metals, especially inside the joint, so as to prevent any issues in the future. Thank you.